Regarding the drug susceptible tuberculosis, new patients with pulmonary tuberculosis should receive a regime containing 6 months of rifampicin. For 2 months, isoniazid, rifampicin, pyrazamide, and for 4 months, isoniazid and rifampicin. The optimal dosing frequency for new patients with pulmonary TB is daily throughout the course of therapy. In all patients with drug-susceptible pulmonary tuberculosis, the use of thrice weekly dosing is not recommended in both the intensive and continuation phase of the therapy, and daily dosing remains the recommended dosing. The use of fixed dose combination FDC tablet is recommended in over separate drug formulations in treatment of patients with drug-susceptible TB. If a positive sputum smear is found at the completion of intensive phase, the extension of intensive phase is not recommended. Treatment of drug-susceptible TB using 4 months regime. This is new regime introduced in the 2022 guidelines. 4 months regime. People aged 12 years or older with drug-susceptible pulmonary tuberculosis may receive a 4-month regime of isoniazid, rifampicin, moxifloxacin, and pyrazamide. And for 2 months they can take all these 4 drugs, and for remaining 2 months they can take isoniazid, pyrazamide, and moxifloxacin. In children and adolescents between 3 months and 16 years of age with non-severe tuberculosis without suspicion of or evidence of MDR or rifampicin resistance TB, a 4-month treatment regime 2HRZE. For 2 months, isoniazid, rifampicin, pyrazamide, and ethambutol, and for remaining 2 months, isoniazid and rifampicin should be used. It is a strong recommendation with moderate certainty of evidence. Drug-susceptible TB and antiretroviral therapy. In people living with HIV, it is recommended that TB patients who are living with HIV should receive at least the same duration of treatment as HIV-negative TB patients. ART should be started as soon as possible within 2 weeks of initiating tuberculosis treatment, regardless of CD4 cell count among people living with HIV. The use of adjuvant steroids in the treatment of TB meningitis and pericarditis. In patients with tuberculous meningitis, an initial adjuvant corticosteroid therapy with dexamethasone or prednisolone should be used, and tapered over 6 to 8 weeks should be used. New patient with pulmonary tuberculosis should receive a regime containing 6 months of rifampicin, including 2 months of isoniazid, rifampicin, pyrazamide, ethambutol, and 4 months of isoniazid and rifampicin. The recommendation also applies to extrapulmonary TB except TB of central nervous system, bone, or joint, for which some expert groups suggest longer therapy. Thanks for listening. Hello everyone, let's discuss the guidelines of tuberculosis, recent guidelines 2022 regarding the drug-susceptible tuberculosis. Regarding the drug-susceptible tuberculosis, new patients with pulmonary tuberculosis should receive a regime containing 6 months of rifampicin. For 2 months, isoniazid, rifampicin, pyrazamide, and for 4 months,